are the signs of a failed IVF? An IVF failure can occur due to several reasons. There may be problems with the egg or the sperm or the embryo itself, or there can be problems with the process in the lab, the technology involved, or there can be a problem with the receptivity of the uterus. In spite of everything going well, sometimes an IVF can still fail. The success rate of IVF is hardly 30 to 40%. So still, after an IVF is a very taxing procedure, and after a person undergoes IVF, we have to wait for 14 days till we get the beta HCG result to confirm a pregnancy. In these 14 days, people seem to be really worried or keep thinking of different ways to figure out whether the IVF has been successful or not. So generally this only adds to the stress, and I would advise people not to contemplate on several reasons that may be indicative of a success or failure of the IVF, because there are so many things that can be either ways, that can work either ways. For example, sometimes people consider that if a vaginal bleeding occurs, then it is a sign that IVF has failed. However, vaginal bleeding can occur even with an implantation bleeding and may actually be a possibility of a successful IVF rather than a failed IVF. Sometimes people believe that there might be mild cramps and abdominal pain that may occur, and this may occur during the transfer due to the pelvic procedure itself, but people may believe that this again may lead to an IVF failure. So they get unduly upset and worried when they face such a problem. However, there are several other issues that are involved that may cause this abdominal cramps or bloating, and this may also be due to the several hormonal injections that we receive post an IVF procedure. So it is always better not to jump to conclusions and to wait till probably those 14 days end and we get a beta HCG test to determine whether the IVF has succeeded or failed. And it is better to relax and to take care of yourself in these 14 days rather than contemplating on something that has already happened. Thank you.